Good evening, viewers. Welcome to the Mind My Mind talk show once again. Today is day 2 of World Awareness Day for ADHD, that is Attention Deficit Hyperactivity Disorder. Yesterday, we spoke with Ms Bedi, who's a child psychologist, about various strategies on how to deal with ADHD. Today, we have with us Dr. Aishwarya Paranjpe, who has been practicing she's a clinical psychologist and has been practicing in the field for over 12 years. And she has been dealing with a lot of extreme cases of ADHD. Yes, we all understand that most problems start in the childhood, as early as almost about 2 to 3 years of age. Because of parents' non-acceptance of this issue, the students at times, or the kids, I should be saying, sometimes go undiagnosed. And that creates a further problem and leads them to, for the disease or for the problem to worsen. So we have with us Dr. Aishwarya, who will help us understand a little better on what happens. So Dr. Aishwarya, first of all, is it right? मेरे मुंह से निकल गया that this is a disease. Can it be called a disease?
It's more than a disease. It's a disorder, okay, which can eventually be cured.
So I stand corrected. It's a mental disorder.
Yes.
Thank you. So Dr. Aishwarya, what happens when things do not get detected on time?
So again, just as it doesn't get very easy for the children when it is at an early age, things tend to worsen for the children as the ADHD doesn't get detected eventually, and things turn really, really bad for them. So coming to the academics, the children start trailing behind. They are unable to cope with the next classes. While they get pushed on to the next classes, they are unable to manage with the academics at all.
And this despite having good IQ.
Absolutely. And as a result of this, their so-called misbehavior starts getting highlighted all the more.
So it impacts their emotional well-being then.
Affects their emotional well-being, and also the fact that schools start now calling the parents over and over again, complaining to them how their child is absolutely ill-behaved, and as a result, often tend to ignore the positive points in the child, which is the biggest thing. So ADHD is not just all about misbehavior. The child, like other children, also has a lot of positives in him or her, which tend to get ignored because the so-called misbehavior starts getting highlighted. As a result, eventually, since the child starts getting pointed out all the time, the child's self-esteem starts getting deteriorated. The child's confidence is at an all-time low. Now, the situation is where his peers, his teachers, and his parents are all pointing out at how the child is such a bad person and does not know how to behave. And there's just about no one for the child to really understand his mind or her mindset. And by mindset, I mean what are the child's actual feelings and emotions is something that just nobody is bothered about at this stage. As a result, the children start getting into depression. They become anxious. They start facing anxiety issues. They start experiencing spells of crankiness. They start blaming themselves, and eventually they also indulge into self-harming behavior. So this comes out of frustration because just the child feels that the child is not being understood by anyone now. So this is all about a child's emotional well-being. On the social front, also, the child is always being pointed out as saying, iske saath mat khelna. The child will teach you how to misbehave. So now the child is also getting isolated in the society. And therefore, the child does not have any friends either.
So loneliness also
Absolutely.
sets in, obviously, all the other issues.
Yes.
So this stage, this happens once things go undetected for a long time, I believe. So to now at this stage to help the children or anybody, even an adult who suffers from ADHD, I believe there is a clinical intervention that is required.
Yes.
So how does one go about that? What happens when a child has to face clinical intervention?
Clinical intervention is basically a multifaceted process, or a multi-layered process, as I would call it. Now, it requires all stakeholders to cooperate and understand what is happening. So for the first time, when the child comes to a clinical psychologist, the clinical psychologist will take a brief history of what has been happening and what are the interventions that the parents have done so far, what kind of punishments have the parents given, whether there are any physical impairments that the child is having, whether there are any deficiencies that the child might be having. So once these are ruled out, like a physical impairment, like an eye impairment or a visual impairment or a hearing impairment are ruled out. Thereafter, the children are subjected or administered an IQ test, just to find out whether their brain functioning or their average functioning is absolutely normal. We generally, the process is that we need to ensure that it is pure ADHD and nothing else.
Okay.
So
therefore, you will go through the whole process of ensuring
process to ensure that the child is only having ADHD and nothing else. Right. So we will also the child examined by a pediatrician, which means an MD pediatrician. So yes, that is something that we really need to.
So it's a biological, social, emotional, psychological screening that the child has to go through.
Yes, yes. So once we are absolutely sure that the child just has ADHD and nothing else, and since the child has gone undetected and the symptoms are really, really very severe, we may refer the child to a pediatrician for some kind of medication as well, so that the child calms down a little.
And also, because pediatric psychologist?
No. Basically, any psychologist will first
or psychiatrist. Sorry, what I meant was a psychiatrist, a pediatric psychiatrist.
Yes. Generally, the pediatricians are quite well aware of the basic drugs that they can administer to an ADHD child. However, if the symptoms don't go away with that medication as well, then we do refer the children to a pediatric psychiatrist as well. However, over here, parents are at a greater comfort if we refer the child to a pediatrician and not a pediatric psychiatrist, because the term pediatric psychiatrist tends to disturb the parents a lot. And then there is
acceptance.
Exactly. So there is a chance that the parents will not go and seek help from a psychiatrist, but they will definitely go to a pediatrician and seek help. So which is what we want.
Okay. And is this, if the child is put on medication, how long does that medication last? Of course, there are many cases where we spoke about yesterday, where we discussed number of cases that were actually taken off medication by the right psychological interventions. But I believe that is only when the disease has been detected early and the right strategies have been adopted. But once things go bad, uh, how long does the medication have to be administered?
I would say that instead of looking at the duration of the medication, I would look at the symptoms going away. And only when the symptoms go away would I say that there is some kind of improvement in the child. So generally, if there is if the child is on a medication and the child is referred to a psychologist as well, then a combination of psychiatric medication and psychotherapy will help to bring about better results. So basically, if we are able to treat the misbehavior, so-called, as it is called in lay terms, basically then the child will be considered as someone who's been treated of ADHD. Now over here, we will have to involve basically training the child's brain to sit in one place, concentrate, and increase the child's attention span. Now, if we try counseling the child into, telling him that you need to sit in one place and you need to concentrate, that is not going to work. So practically giving the child activities whereby the child will be able to concentrate and improve his attention span.
Despite the fact that the child is on medication, the child can still overcome through ADHD through various strategies with a multi-faceted approach of a psychiatrist, a pediatrician, along with a clinical psychologist. And of course, child psychologists or student therapists, child therapists on the school premises as well. What happens as the child grows older? Are there, if the child gets cured, are there possibilities of relapses later on in phase, in older phases? For example, adolescence is a painful period any which ways.
Yes.
Right. Even for a child who's absolutely normal. Now, as a child with ADHD, when they grow, can this become a problem?
See, when I say ADHD gets cured, you will have some side effects of it, which will last for a lifetime. So something like inattentiveness or getting distracted by very small stimuli in the environment will still remain. So even if I say that ADHD can be cured, yes, you will have the after effects lasting for a lifetime. So yes, you will see such things.
So it's basically you have to have a process that works for you lifetime, and that involves a lot of the stakeholders to be aware of how to deal with that.
Absolutely, absolutely. And not even one stakeholder giving up can really work in the benefit of the child.
Excellent, excellent. So, Dr. Paranjpe, as a closing note, what would your advice be to parents of ADHD children, to the children who suffer from ADHD, and adults who suffer from ADHD?
As a closing note, I would like to say that never give up hope, because hope is something that keeps the worst of cases to their best of abilities. And so I would like to tell everyone, not just parents or children having ADHD, but just to everyone, that hope is the basis for everything to fall in place. And when you have hope, things fall in place automatically. And of course, that has to be supplemented by hard work and dedicated efforts towards improvement.
Thank you so much on that note, especially All the more a big thanks because you're suffering from viral. You were in the emergency also yesterday, and yet you were here to help us understand this topic better. Get well soon, and thank you so much. Thank you, dear viewers. Thank you, dear viewers. And if you like this talk of ours, please do press like and please do subscribe to our channel and share this ahead with those who might want to understand a little more about this topic. Thank you very much. See you soon again.